Welcome to episode 4 of Now What, an on-demand panel discussion series about how the present and future of healthcare marketing are changing right before our eyes and what to do about it. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge their way of thinking and lead meaningful change. I'm Jared Johnson, digital business strategy consultant and host of the Healthcare Rap podcast, where yes, we rap about changing the status quo in healthcare. With me today are Jhaymee Tynan, Assistant VP of Integration at Atrium Health, and also was named one of the top 25 emerging leaders by Modern Healthcare. I wanted to make sure I mentioned that. And James Gardner, healthcare strategist, sales and marketing leader, and digital media instructor at Northeastern University. Jhaymee and James, how are you doing today?
Doing well.
Doing well, Jared. Thanks for having us.
I'm so excited to have you two on this because as we've just been releasing the first couple of episodes in this series, I'm finding the interest in vocalizing the conversations that we're all having right now in our various healthcare organizations and consultancies and on the side. Let's vocalize that conversation. You know, that's the whole point of this whole series. We're all thinking these things, and let's see what we can do by bringing that conversation into the forefront, into the spotlight with everybody. So the first 3 episodes of Now What talked about different various aspects of healthcare marketing, kind of the present and the future. And they're all available on YouTube by searching for Shift.Health. In the first episode, I spoke with Paul Soblowski and John Marzano about how the pandemic is a catalyst for change. In the second episode, I spoke with Dan Dunlop and Haley Height on starting points for your post-pandemic plan. And what's ironic is when we filmed that, when we recorded it, just days before we published it, it almost felt like we were talking about it too soon. And now we know we're not talking about it too soon. Everyone's talking about it right now. What's that post-pandemic plan? And episode 3 was a digital deep dive with Paul Griffiths, Christy Ebong, and Chris Hemphill, where we dove into chatbots and CRM and the digital customer experience. So in this episode, we're addressing where business strategy is being affected. We're addressing where it goes from here. So to set the stage for that, here's a reminder of the new reality of healthcare strategy that's happening right now. The world of business strategy was already in the midst of, I'd consider it a transformative change, and I think everyone would call it that, as hospitals and health systems have been making efforts to transition to value-based care. And that's not exactly a simple thing, Jhaymee and James, as you both know. That was not just a flip the switch, and now we have a value-based strategy, and we're doing that, right? Understanding the right investments and partnerships and staffing models and investments and locations, referral patterns, service lines, your market development, your growth strategies. Those are just a few of the variables, and there were very few clearly proven answers, it felt like. And then COVID-19 happened. That was all the change that was already happening. And then COVID-19 happened, and it's thrown what was left from the strategy playbook out the window. So today we're going to talk about where business strategy goes from here, not just during the crisis, but in the coming months and years. So let's dive right in. Jhaymee, I'm going to throw this first question out to you, if that's all right.
Yeah.
Where should hospitals and health systems be paying attention during the pandemic? What should they be paying attention to regarding their business strategy during and after the pandemic?
You know, Jared, I think it's a fantastic question. And I think one that a lot of health systems and hospitals are grappling with right now, quite honestly. And as a healthcare strategist and planner, I'm going to probably take a little bit of a departure to what would be a traditional answer to that. Most people would want to go to looking at, what was our growth plan, or how's our growth plan affected by the pandemic? Where do we need to pivot our growth plan or look at different opportunities for revenue and margin growth? And I think for me, what I see the opportunity is to focus on your people. And I think people absolutely are the cornerstone to any strategy, whether it's a business strategy, whether you're thinking about expanding geographically. And I think also gets overlooked a lot when you talk about business strategy. There's a whole lot of research and anecdotes and quotes about how culture eats strategy for breakfast. I think people are the amplifiers of business strategy. I was on a webinar a couple days ago by the Brightline organization. They are kind of like a research group for the Project Management Institute. And they talked about strategic waste. And it's something that I think is absolutely tied to the lack of focus on making sure your people are okay, that they have the skills and the tools and the resources to thrive. And they say that every second there's $20 million that is wasted on poor strategy implementation. And if you look at that over a year, it's about $2 trillion, which many of us probably anchor on that number because it's what President Trump just approved to help amplify our economy, right? And I think one of the most important critical aspects of business strategy, especially during a pandemic, is to make sure your people can stay focused. And I see a lot of organizations having their people with a lot of anxiety around what does this mean for their jobs? Are they going to get furloughed? What is going to be that world that they come back to once we're through all of this? And they can't focus on actual, work, doing the work of the business. And I think it's so critical that organizations put people first, become people obsessed, put their people at the center of their business strategy. I think after the pandemic, your people are still going to be there. They're going to come back and they're going to want to know that they have that comfort and calm to move forward, that they understand what that new strategy might be. A lot of organizations are thinking about and developing scenarios about what their strategy is going to be post-COVID, post-pandemic. How do you amplify your people to be able to deliver on that strategy? So I think for me, when I talk about strategy, specifically in healthcare, it's how are we ensuring that our people are absolutely given the ability to succeed in delivering on that strategy.
I love that. So this isn't necessarily a question about the what, maybe it's the question about the who is involved from
absolutely.
here. James, what do you think?
Yeah.
I love Jhamee's line of thought on that. What is a hospital or a health system if not a collection of really highly skilled, caring, and compassionate people? And especially post-COVID-19, we are going to see a lot of systems where, frankly, the teams have been pushed to their limits, to their absolute limits, and probably beyond, in the pursuit of giving great, compassionate care and taking care of people afflicted by the virus. So on the other side of all this, Jimmy's exactly right. We're going to look back and ask ourselves, how did we help our teams get through this? Did they feel supported? Did they feel like we had their back and we're giving them the tools, the equipment, and the support they needed to do their jobs and deliver great care? Or did we leave them and falling short? And that will be inexcusable. And to Jhamee's point, life post-COVID, it's also going to be really dependent on people at the foundation of executing the strategies that are put in front of them. So I can't imagine anything more significant than looking internally and asking that hard question of, are we doing all we can for our people right now?
And I love that, James. And I was going to say, to your point, I feel, and maybe individually we're feeling the same thing, but I feel like there's a general sense of fatigue that people are feeling, having to either support their organizations through this pandemic, being redeployed to different areas to make sure that we can deal with the surge. And so they're going to come back from all that fatigue, and they're going to want to know that, the organization supports them transitioning back from this collective experience that we're having. And if they're not getting that support, you're going to have different challenges as an organization to truly start, delivering on that strategy, either that you had post-COVID or the one that you had to pivot during the pandemic. And so if we're not careful and putting our people and giving them that safe space to go through that, I think we're going to have some really important challenges to face.
I agree. I think we would all have a concern about physician and clinician burnout as a recent phenomena to begin with. If anything, the times we're going through now exacerbate that risk and extend it beyond physicians to the entire staff of a health system, just because of the immense stress that we're putting people under and some of the horrific conditions and horrific situations that people are being exposed to. There's going to be, after effects that we're going to have to support people through.
I love this whole line of thought. It's not something that I have heard a lot about, really, just people even discussing right now. So I think bringing this to the forefront is going to lead us to some, hopefully, some thoughts and some actions that we can take as healthcare organizations. So great discussion. Okay, James, you're up first on this next one. What lessons are we learning about responding to disruption? I mean, COVID-19 is nothing but a disruption, just not the type probably anyone predicted at the beginning of this year. right? So what lessons are we learning about responding to disruption that we should keep in mind as the crisis does subside? Eventually, it's going to eventually.
So disruption of healthcare is not a new phenomenon. I'm sure around the table here, we all have been thinking about it and talking about it for years, just all the changes that are on the horizon. But to be honest, it's always seemed, at least to me and to the practitioners I speak with, as somewhat of an abstract notion that, yes, I know things are changing, but I'm so busy and stressed that I hope someone else is worrying about them because I don't have time. And yet these changes are immense, and they range from telemedicine to disruptive care models to new competitors to consolidation of the industry. But they've always seemed a little bit on the horizon. I think COVID-19 has changed all of that. It is what I would consider a black swan if you were an economist, thinking about events that are so massive, so complex, that we can't or don't adequately prepare for them. And while there was a lot of preparation, obviously, amongst epidemiologists and others who think about pandemics, it's clear that COVID-19 has overwhelmed anything that we'd ever imagined. So the upshot of all that is it's changing the world around us. It's certainly changing America in really unexpected and probably profound ways. From the most mundane, will we ever feel comfortable shaking hands with strangers? To, will public transit or attending a movie in a crowded theater ever become something that we're comfortable doing? Never mind some of the macro issues of, how are we going to think about borders between countries? How are we going to think about supply chains that span the globe and the mobility of people? So there's immense change happening in our culture at a global level, and it's happening in front of us at a speed which is unimaginable. Translate that to the world of healthcare, and I think you can jump to the conclusion pretty quickly that our world has changed too. We're seeing, as an example, the emergence of telemedicine at a rate that was unimaginable 3 or 4 months ago, for many reasons, but that's like a major change that is now not going to be reversed, I would argue. And it's a long list of other things akin to that make the landscape for healthcare marketers specifically very, very, very different. So if nothing else, take a call to action, fellow marketers, that when we get to the other side of this pandemic, the world is going to be different. The world is going to be different in ways that are unimaginable, but that will make old playbooks obsolete and make our old way of going to market probably out of touch with the new reality. If that wasn't like daunting enough, there's the reality that for a lot of marketers, they're going to be doing all of this with smaller teams and less resources. It's no secret a lot of health systems have been greatly weakened by the fight against the virus. And unless marketers have really done their homework and have got accountability in place, they're going to be asked to do more with a smaller headcount and smaller budget. So let this be a wake-up call, if nothing else, that within weeks or months, knock wood, and we get to the other side of this pandemic, marketers across the country are going to be going to work in a completely new and unexpected environment.
Jhaymee, what's your take on all this?
I love what James said, because I think it's absolutely true that disruption really isn't a new concept, I don't think, in healthcare. And we've been on this kind of disruption for quite some time, and this transformation for quite some time. So for me, when I think about healthcare strategy and planning and marketing, I think we have to shift our mindset from reacting to disruption to anticipating it, and then turning that anticipation into opportunity. And I think you're seeing some of that playing out real time right now. You're seeing healthcare organizations shifting, redeploying their teams, thinking about healthcare delivery differently. And I think that's truly, when we come out of this pandemic, we'll all be thinking about healthcare delivery much differently. I've heard from some of my colleagues at health systems across the country that maybe their organization dipped their toe into telemedicine, but now, I mean, it's been accelerated, many, many times over to address the demands of the community. The other thing I was going to say, I read a very interesting article from, I believe it was the Washington Post, and it's in relation to, COVID-19. And the title of the article was the 2020 Great American, I think it was the 2020 Great American shift as far as where you were living, right? So, a lot of times, patients were living in these very densely populated cities like New York, LA, Chicago, and I'm sorry, it was the Great American Migration. That's what it was called. And there's a thought that healthcare delivery will continue to be disrupted because people will be leaving these large cities and moving into what they call these mid-rural cities, which are less densely populated. You have more space between you and your neighbor. There's not a potential rapid, expansion of virus. I think people are starting to get a little bit afraid of living in densely populated cities. So telemedicine becomes a way of delivering care differently, but there are other ways that I think we're collectively thinking about healthcare delivery and moving outside of the four walls of your hospital. So I think that disruption is absolutely something that will continue. I think you have to start anticipating that change and coming up with scenarios and imagining the future. I think more healthcare marketers will become futurists, quite honestly, because they're going to be thinking about, thinking 2 and 3 steps ahead of what's going to happen in our healthcare industry and helping our organizations truly understand that. So I feel like there's a role to play. There's a futurist role to play in being to anticipate disruption.
Well,
what a powerful idea, if I could just jump in there. This golden opportunity for marketers, as you said, to shape the future. I find that really exciting and compelling, and to not be reactive and to not be at the receiving end, but instead to be leading the organization into new delivery models, into virtual, into other worlds where there's great opportunity for innovation and disruption. And the notion of marketers being at the forefront of making that happen should excite all of us.
I agree.
So can the way we respond to disruption be a competitive advantage?
I absolutely think so. And I feel that organizations that have created more of an agile mindset to strategy, to business strategy, are able to be flexible when these sorts of disruptions happen. And I think you'll see more organizations take more of a micro strategy approach and doing more testing and doing more sensing and less, here is this big, beautiful 5-year strategic plan, and it's going to be the be-all, end-all to how we grow. I'm also seeing strategic plans becoming more like 3-year or less plans, right? Because of how quickly healthcare is changing. So I think organizations that are able to make faster decisions, quite honestly, and are able to pivot are truly going to have a competitive advantage. And again, it comes back to people, right? Have you prepared your organization to be able to pivot? Do you have the right decision-making models to be able to, on the fly, think about and imagine what a new strategy could be? And I think a lot of health systems are going through that exercise right now and doing a lot of scenario planning. And some are doing it better than others because they have the tools. So I absolutely think it's going to be a competitive advantage.
James, I think that speaks to, I know James is a hockey fan, so James speaks a lot about skating to not where the puck is now, but where the puck is going.
Yes, the great Wayne Gretzky taught us this years and years ago, but it's advice that never gets old. And Jhaymee exactly right. The opportunity for competitive advantage will go to those organizations that don't try and go back to the old playbook with a 5-year strategic plan, which is such a tired idea when the world has changed so dramatically in 3 months, as we've seen. So the idea of a 5-year plan, even a 3-year plan, seems preposterous. But the need to be just nimble and be innovative, it's going to create opportunities for those who can grasp them, both people and organizations, to really step ahead of the rest of us. Yeah, so exciting times.
Very.
They really are. All right, so once again, you're tuned into Now What, an on-demand panel discussion series about how the present and future of healthcare marketing are changing right before our eyes, and what to do about it. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge their way of thinking and lead meaningful change. I'm here with Jhaymee Tynan and James Gardner. All right, Jhaymee, I'm going to start with you again on this final question, which is really open-ended. I'm really curious what you think about this. If you can name one thing for healthcare marketers and communicators and strategists to keep in mind that will help them now, both during the crisis and in the post-pandemic world, something we just haven't mentioned yet.
You know, I've been really inspired, quite honestly, over the last several weeks of the role that healthcare marketers and communicators have really rose to the occasion for, and that's education. And I feel like with this pandemic, a lot of my marketer and communicator friends have spent a lot of time wanting to make sure that the right information about COVID-19 is being disseminated to the public, and taking a role to dispel myths and taking a role to educate and make sure patients understand what's happening, what's real, what's not. And I think post-pandemic, that's going to be a very important role to continue to have. It's more than simply trying to match services to patients and market that. I think that education is going to be the brand enhancer for a lot of healthcare systems if you get it right. Being able to be at the forefront of that and being a trusted resource for that education, I think is going to be very key. I also think, kind of as an offshoot of that, I think healthcare marketers and communicators should still want to be the storytellers. And I think you have a very important role, especially during a pandemic, of telling really good, compelling stories about the light at the end of the tunnel with all of this, and having a positive outlook on sharing those acts of kindness that are happening across within your community, and how people are truly rising to the occasion and being kind and being empathetic. And you're going to see more of those themes, I think, coming out in healthcare marketing, because it's truly what's uniting all of us right now is that empathy and that kindness. So I think between being strong educators and playing that role and continuing to tell compelling stories, I think those are the things that, now and after the pandemic, healthcare marketers and communicators should continue to do.
Awesome. All right, James, what's your take?
Looking outside of your organization and being kind of outside in your thinking has always been a good idea, in my opinion. But now I think more than ever, great ideas, while they may come from within your four walls, in my experience, are much more likely to be found outside of your organization, whether that's the patients and consumers that you're seeking to serve, competitors or potential allies that are outside of your four walls. That, I think, in a lot of cases is overlooked. But now more than ever, with the environment changing and this disruption that we're being faced with, I think healthcare marketers would be really well served to take their beat from the people they're seeking to serve, understand the new realities that they're facing, and shape the strategies and shape the organization to align with those.
Thank you. I think we can, that's really a good guiding principle, almost like a guiding star, right? Kind of in this, if you think of it almost like I don't think any of us, well, I know, like nobody has a roadmap. Like nobody's handing us the playbook for, oh yeah, now here's what you do after this exact type of pandemic has just redefined everything. We don't know what the new definition is. So nobody's handing anyone a roadmap. We're all learning it together, and we kind of have a compass. Like we know generally which directions, and those directions are changing a little bit every day. And yet, so if we think of it as having a compass and we've got to set a course based on, what are we even based it on? Well, maybe there's a few stars out there in the sky we can kind of use as our guidance, and we'll go that direction. We don't know exactly where that destination is, but we know we can't sit still. And I think that's kind of my take on all of this. From a business strategy, there's a cost to doing nothing. There was a cost, and that's what we just don't think about. We typically think of, James, as you said, like disruption as this ethereal kind of abstract notion that's way off on the horizon. And now we know it's not. And now we know we don't even know what disruption is, what it looks like anymore. it's just going to come from somewhere we don't expect. That's almost the only thing we can guarantee. And so we do have to think about the being agile, Jhaymee, to the point you were speaking of several times about being able to be agile and nimble and be able to pivot. That requires an entirely different structure within our organizations. And so I think even just, if anything else, what the whole crisis, what this whole outbreak has taught me is the necessity of that. Not just, hey, it's nice to be a little more agile, but we're still going to go do things the way we used to. There's no status quo anymore. And this isn't as simple as unpausing the things we were doing. And now, hey, let's dust off the 5-year strategy that we had. We'll just go back to that. It's just like we just cut out a couple months of it, and now we just go right back to that.
Mm-hmm.
We are evaluating every aspect of what's coming next, and I see that as a net positive. Man, it's painful. It is painful right now, and it's probably gonna be painful for a while. And yet I do see the ultimate outcome as someplace that I think will be better for all of us. I'd like to think that. If I thought otherwise, man, every day would be really even more rough right now. But I'd like to believe that.
And Jared, to that point, when both of you have talked about playbooks, what's been inspiring to see is are other brands, other organizations who have really, pivoted on the fly throughout their playbook. And I think back to, when I look at the retail industry, how some of, luxury brands have decided to turn their factories to make hand sanitizer, right? Or to make face masks. And they're pivoting on the fly as a way to obviously, make an impact during the pandemic, but it's allowing them to think differently about how they deliver their product and what do they do when they can't deliver their product anymore, right? What are other alternatives? Right. And so you're seeing inspiration from organizations that are just able to quickly pivot. Okay, we're not going to do this anymore. We're going to develop a different product for the time being because it's what's needed in the market right now. So it's amazing to see some of that very quick thinking and easy pivot that organizations have.
For sure.
I share that sentiment. And Jared and Jhaymee, I love your optimism. I love your sense that inside every crisis, there's an opportunity for the brave and the nimble and those willing to seize the opportunity, despite the prospect of it being sad times at times. But we will get through this, and a select few will emerge stronger, better, and better positioned for success. We all know that.
I agree. I want to thank you both for being a part of this, just getting us thinking again, just bringing this conversation to the forefront. A lot of people are having similar conversations around the country and around the world, and I thank you for bringing this one into the spotlight. I want to give you both a chance. How do people follow you on social media if they want to connect with you, James, first, and how do people do that?
You can find me quite easily both on Twitter at James A. Gardner, Gardner, but also on LinkedIn, where I've got a very active presence. So I encourage anyone who wants to continue the conversation to reach out to me on either platform, and we can talk more and share stories and celebrate successes.
Excellent. And for me, very similarly, I'm on Twitter and LinkedIn. It's great having a name with an unusual spelling because on Twitter, it's just my first name, Jhaymee, which is spelled Jaymee. I'm also on LinkedIn. And then recently on April 1st, I launched my personal website, which is JhaymeeTynan.com. So I'll continue to have blog articles, and I'll probably be featuring this video on there as well, and giving Jared, some props for convening all of us together to talk about these things. But again, feel free. I love to have conversations and talk about healthcare strategy. So please feel free to reach out. And I'm hoping that James and I can continue the conversation because I was really inspired by the things that you said, and and share a lot of the same thoughts too.
It's very kind of you, and the feeling is likewise.
Yeah, thank you both for joining, and thank everyone for watching and tuning in. Thanks for joining us for this. You can check out the entire series on YouTube by searching for Shift.Health. Again, it's called Now What? This is the fourth of the 4 episodes in the series. It's produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge their way of thinking and lead meaningful change. Thanks again for tuning in.